The GANC Malaria Surveillance TA approach focuses on building government ownership right from the start. Specifically for CHAI, we work closely with the government to contextualize the solutions to the state-specific peculiarities, therefore putting the government in the lead. In addition, the approach is also very heavy on capacity building for government staff, on the use of data for planning and programming, as well as the application of innovative approaches like the human-centered design in driving solutions for challenges that will be encountered during the implementation process. Value additions of deploying the approach through the TA Hub is definitely the enhanced coordination amongst grantees and partners, as well as the improved collaboration and cross-learning. One of the key lessons learned of implementation during the pandemic is the importance of remaining flexible, strategic, as well as inclusive, making sure that you carry every single stakeholder along the process.
So far, we've had several engagement meetings with DAI, most especially on how to provide assistance technically to Kano State Primary Healthcare Management Board, especially with regards to implementing evidence-based programming and activities to improve our performance and an agency. This is important because Primary Healthcare Management Board is the driver of primary healthcare activities in Kano, and which translates, if we are doing our activities very well, it means our goal of achieving universal health coverage is certainly going to be attained.
The TA Hub has been assisting the state in trying to pilot the Group ANC, which is a new innovation to Kano State. If actually implemented, will have some added value to accessibility of ANC and further improving other maternal and child indices in Kano State.
For us, is very significant. If you look at the areas the TA Hub wants to or is supporting Kano, which means our performance will be enhanced. Health targets will be achieved more easily through the evidence-based programming and implementation of activities, and also to ensuring that our resources, the resources that is channeled through the primary board, is optimized for the betterment of the people of Kano. So I would say it is a great journey so far.
Looking at the issues of human resource for health that the state is in, it will help in improving the services at the ANC, giving quality services at ANC, where you see women coming for ANC will have to wait for a very long time before attended to due to this issue of human resource. And with this group ANC, it will ease that.
Already we have gap in the state in women attending ANC. And this group ANC is going to make a very good impact in bringing our women to ANC. They've been working hand in hand with the health workers and everything, so that they're even bringing us on board so that the program will be accepted in the state. And we accept what they are doing, and we are saying well done to them.
Yes, the TA expertise will have a great impact in the capacity building of both the state and the service providers at the health facilities.
This group ANC is a new concept that is coming, and if you see the male involvement, that will even increase the number of women accepting to come for ANC and at the same time coming to deliver in the facility. The men also that are involved will help in postpartum family planning. We are going to have a high turnout of women accepting the group ANC and accepting healthcare services in the state.
So actually, our plan in DAI, the technical hub, is to actually support the states towards strengthening the primary healthcare system so that service delivery at the primary healthcare centers will improve across the state. After then, we can now see how the whole entire health system in the state, including the secondary facilities, will improve. It is when we achieve that later now we can see how we can expand as we have the discussions with the entire state. The buy-in is there in the state that we are interacting, for example, Kano and Kaduna. So we can work with them to see how we can expand to other sectors like education and some other ministries.